Welcome back, Tammy, to the second half of
Nice to
your
see you again.
story. Uh, so we left off a little bit, kind of getting into the part of your patient journey about advocacy and kind of what brought you into our space and what it means to advocate for yourself and what being a patient advocate is for others and all that good stuff. So we will dive right in whenever you're ready.
Okay. Thanks, Sam, for having me back. Long time no see. Um, yeah, so to kind of expand on what I was speaking on earlier, myself nor my family knew how to advocate for me at the time. Um, and the area we were in, I'm not sure if we had advocated much, if we would have been able to come up with any other resources for me. Um, but unfortunately, we didn't even try. I think I had
Mhm,
said before, not even certain I would have, really put together what advocate would have meant back then at that time. Obviously, through my journey and as my journey has continued to progress, advocacy has become an extremely important part of my life. Um, I have both been a patient in advocacy, um, and through G-PACT, um, I, in talking with you, it was very important to me to be more of an advocate for others,
mhm,
in a role, especially for gastroparesis. That's really where my heart is. Um, because of the lack of advocacy and lack of resources I have lived with for what at this point in time was the majority of my journey. Um, and so, you helped me along the way, and I applied and took the test for the BCPA exam. Um, uh, thank you.
mhm.
I have been an advocate for family for years, since about 2014.
Mhm,
Um, and what I have learned along the way is that I'm a pretty decent advocate for other people, but I'm not always for myself. It's a lot
Yeah.
easier for me to, speak up for my family member that I see being dismissed or that
Mhm,
I see not just taking at face value what they're being told. And so I say, no, ask these questions. I
mhm.
can do that, so much easier for other people. But
Yep.
because of where my journey started and the fact that I didn't have an opportunity and didn't know that I could ask questions, also didn't know what questions to ask. It's important for me now um to at the very minimum let people know, especially the newly diagnosed gastroparesis patients, it's
Mhm,
okay to ask questions. It's
mhm,
okay to say, "No, I don't want to try this." It's okay to pause and say, "Before I start this treatment plan, I want to do my own research."
mhm,
I don't think that is disrespectful to our physicians who are trying to help us along the path. I think it is smart. I think
mhm,
today we have learned a lot more about medications. We have learned, unfortunately, the bad parts that go along with taking some of the medications.
mhm,
When I was diagnosed, I was not told anything about the bad parts of the medication.
mhm,
If I had been told, I may have been able to make a different decision, and that would have led to very harsh things happening in my life, maybe not happen the way that they did.
mhm,
Um, so for me, being an advocate, other people being an advocate for me, as I said, I have been in advocacy. What I have learned through that is, unfortunately, there are bad advocates out there too. So,
mhm,
um, I firmly believe that the best advocate for you is yourself. You just
Mhm.
have to educate yourself. Um,
Yeah.
so and I'm not s that's not to say that every advocate is bad or that anything like that. I mean, I've had good experience with advocacy. I've had bad experience with advocacy. Um,
Mhm.
but at the end of the day, what I have realized through this journey, and probably even more so over the past 6 to 9 months and becoming a BCPA myself, is that this entire time, I had the resources and the knowledge and the education I needed to be my own advocate and to
Mhm.
be my best advocate that I could have been, and I just didn't put that into fruition. Um,
Yeah.
again, it's one of those situations that I said, I'm really you know that my mom's in poor health and her health has
Mhm.
declined over the past 4 or 5 months significantly. Um, and, I know that I'm a good advocate for her. I know that she is getting full 360 care. Granted, I'm doing some of that. But, my I's are dotted and my T's are crossed. My journey began when the stone tablets with the I's and the T's. It took
Mhm.
forever to dot those and cross those.
Mhm.
Um, so it's important for me now to make sure that newly diagnosed gastroparesis patients are educated.
Mhm.
And I think that journey is going to look different for everybody. Um, that might mean to some people asking more questions at your appointments,
Mhm.
being prepared with a list of questions. You can get those by speaking to another gastroparesis patient, an advocate if you choose to reach outside of yourself for an advocate, or the resources that we now have electronically. The resources that are available now, I believe, only lift up whether it is self advocacy or advocacy for others. Even in advocating for others, a lot of my resources that I find for them, come from the internet.
Mhm.
Um, another area that I think, could be more helpful to newly diagnosed patients in terms of the advocacy is that if we get more education, to the GI offices, to the motility clinics, because there's nobody that I have had a conversation with that is walking through our healthcare system that is pleased with it.
That's putting it so mildly.
Yeah, that's extremely mild. You told me I had to be
Mhm.
mild. So, I'm trying to be mild. As a patient in the healthcare system myself, as a daughter of patients who are in the healthcare system, as
Mhm.
a friend to friends who are in the healthcare system, um, I get angry more so with the dismissive care of my family and my friends than I can myself.
Yep.
Um, but, I've grown a lot in that area. And I want to encourage other patients to try to grow in that area, try to be their
Mhm.
own best advocate. I believe that I have walked the journey from no advocacy, not even knowing what advocates were, not even knowing
Mhm.
that I could advocate for myself, being diagnosed at a time that that wasn't a thing. That,
Mhm.
you were taught, you go to a doctor, you listen to the doctor, and that's that. You take what that doctor says. To this journey has taught me that that can we can't rely solely on just one medical opinion that we get. It's
Mhm.
okay to ask questions. It's okay to get second opinions. That second opinion might not lead to any different diagnosis. It could lead
Mhm.
to a different treatment plan that might work better for you. It can lead to more resources that that physician or that care team might know about better than a previous care team. I think that healthcare has expanded, and I think that's a positive part of healthcare. If I
Mhm.
look back where I began and my resources in the mid-90s and the
Mhm.
resources that I have now in 2026. Obviously, there's expansion in that.
Yeah.
Expansion, I have noted, also doesn't always mean quality.
Mhm.
My quality of care that I received from my physicians one on one in the mid 90s was exponentially greater than the
Huh.
quality of care that I receive now one on one from my care team.
Mhm.
I respect and appreciate the care that I get, and I always have. But I have learned that if they say, well, let's try this, it's okay if I say, what are the side effects of that? What is the
Mhm.
purpose of that? What is
Mhm.
the goal? When do we say this didn't work? And if this didn't work, where do we go from there?
Mhm.
Um, in the mid 90s, there were no questions. It was, we're going to do this. And I would say, okay. And that was that. But the personalized care that I received in the 90s, the literally at times, the GI sitting next to my hospital bed, holding my hand, letting me
Mhm.
cry and fuss and complain. Now you do good to get a 15-minute interaction
Yep.
with your physician. Um, and that, obviously degrades the quality of care that you get. I didn't
Yeah.
have the resources that I do now, but I had trust in the mid 90s of my care team that has dissipated as time has went on, and that we're in the midst of the healthcare system that we are. And I think
Mhm.
that means that the most important thing that we have to have on our radar is the self advocacy for ourselves. Also, too, you should be able to ask your questions without fear of being bit back at.
Mhm.
Doesn't mean it won't happen. Some
Yeah.
physicians don't like being questioned.
Yep.
So you might have to grow a little thick skin. And I've noticed throughout my journey is that's what has happened. I
Mhm.
don't have a care team right now that I can't ask a question to.
Mhm.
And that is some by choice because I have let go of other people in my care team throughout the years that I could not safely come to and say, why are we doing this? Why can't we do
Yeah.
this instead?
Mhm.
And unfortunately, you're just going to have, unfortunately, you will find that in the healthcare system. You have to decide for yourself. Can I live with that? Can I live with being treated that way and not being able to feel like I can self advocate for myself? And if you can, then so be it. You know,
Mhm.
um, if anybody knows anything about me and my advocacy, whether it be for myself and for others, is autonomy is of utmost importance to me.
Yeah.
I may not agree with your decision, but I'm going to support it as long as it's
Mhm.
safe and legal. I'm going to
Mhm.
support your decision. I'm going to stand on that hill with you.
Mhm.
Um, and a lot of that comes from experience in other people push things on me because they thought that it was the best for me, but it wasn't. And even if I was pushing back then, I just relented and would say, okay, I'll do
Mhm.
whatever. And in the end, it would end up harming me in some way. Maybe that was making symptoms worse, or new symptoms would develop that were intolerable. As a patient, and especially if you're a long tenured gastroparesis patient, you know your body better than anybody. And that includes the physicians that are sitting across from you. Even
Yep.
if you're newly diagnosed, you you know your body. You
Yep.
know you know what's best for you and what isn't. And not
Mhm.
everything that you're offered is what's best for you.
Mhm.
And today, people and patients have the luxury of being able to utilize our digital world and come up with ways to help them advocate more for themselves. Now, in addition to that, I think you do have to be careful. You have to be able to do your homework and know what is legitimate on the internet and what isn't.
Yep.
Um, I don't. But I think more than anything that we should use our digital world to help us advocate. It can be a great
Mhm.
tool in your toolbox to help advocate for yourself, whether that be in the beginning to develop a treatment plan or whether it be you having to go to your physicians and say, "This is not working for X, Y, and
Mhm.
Z, and we need another plan." And I think
Yeah.
that's hard to do. It was hard for me to do in the beginning of my healthcare journey. That's a combination of just my journey, um, that started 35 years ago. It's through experience realizing that any advocate that I have had, no matter how good they've been, they still can't advocate as well for me as I can myself.
Yeah. No, I think, what you've been through and what I know you have done and continue to do, like your experience has been so invaluable to just me and to the rest of our support groups and the people that you interact with. And anybody that has attended our support groups knows that you are full of so much information and always there to encourage advocacy. And that's something between that and relying on information that is good information. We see misinformation across the internet everywhere. Like it's the dark side or the lighter dark side of the internet. We'll leave it at that. Of the things that can be harmful, especially for our patient community. So, hearing from other patients, speaking to other patients, and understanding that you're learning from their journeys and their experience. It's not medical advice, and looking at it as advocacy and helping build those resources going forward. And for organizations like ours to really talk with the experts, talk with the clinics, and get that reliable information in a tangible way to the patients is so incredibly important. And I know that is, for you as a patient, that's important. For us as an organization, that's important. And just for all of us going forward, because if you don't ask questions, then you're missing out on possible answers, and that
Right.
part can be very hard. I shut down. I feel like there are times where I walk in, I've been in appointments ready for a fight because I didn't know what to expect. I've gone in neutral and just kind of sat back and been like, what the hell did you just say to me? And then there's other times where I've been so frustrated that I shut down. And I
Uh-huh.
feel like I speak up for myself pretty good, but there have been a couple times, mostly hospitalizations after a certain amount of days, where I just look at my husband and he's like, "My turn." Like like, they put me in and I need somebody to step in for me. So
Right.
having the information and the confidence and the education on what it means to advocate for yourself, while also building a support and care team to the best of your ability to advocate for you when it's really hard, because this is overwhelming. You get burnout,
Mhm.
and sometimes you're just tired of fighting because it's a lot to live with this daily, let alone fight for better daily. So
Exactly. Yeah.
it's hard. It's hard. But thank you so much for sharing all of that with us. I know it's not easy to talk about, things that you've been through, especially with some of the volatility that this disease has caused, in your life. And it's, I don't want to say like, but look what it brought you, because that's toxic positivity. But it, your experience and what you've been able to do with what you experience and what you're using that to bring forward to new generations of advocates, new generations of patients, and all of that is really, it says a lot about who you are. And we just really appreciate everything you do for us. We love you. You are stuck with us forever. And just really appreciate you chatting with me today. So thank you.
Thank you, Sam. I appreciate y'all.